Right, so when we talk about the pelvic floor, it is this hammock of muscle that I drew first that supports three organs, bladder and the urethra, the uterus in the middle, and it has very important part, the cervix and the vagina, and the rectum, which is the last part of the bowel. The rectum comes out here as anal canal. The vagina comes out here as in the introitus, and the bladder comes out here in the urethra to empty outside. This hammock of diaphragm or support is a little bit higher than what you see here. So we just see skin here. And there is a space between the skin and the hammock. What happens is when we say there is pelvic organ prolapse, you can read about it, it's called POP, P-O-P. It means this hammock is weak and it's coming down as low as sometimes, especially in elderly women, it can come down really down here, the whole hammock. But what appears more to people, that part of the bladder here drops, and they call it this way or this way, and it appears inside the vagina, which is called cystocele. Or the bladder leans forward into the vagina, and it's called the rectocele. Or the cervix comes out certain degree, certain distance, and that's uterine prolapse. Or the bowel comes out and becomes rectal prolapse. So there are so many types of the same disease, POP. Why am I saying that? Because I'm yet to see a lady who has a problem in one of the compartments and not the others. It's usually there is. That is why our treatment fails, because we focus on what we see, fix it. And when it is actually fixed properly, it highlights the other problems a lot more than they are. So we have to look at the whole problem as it is. What we have, what I've seen now, two things. The cervix is coming down and the bowel is coming down. I will zoom into this. I will, if the rectum is like that, what happens to it? It forms like that. At one stage, as he explained to me, it came out. And you saw it in 2 inches. But now, as I can see with the internal examination, I can see this area that would have come out in the past. If we look at the uterus, it's like that. And the cervix is coming down, so the vagina is folded this way. So that's probably about an inch lower than it should be. So these are the two problems. We can also see this hammock is lower than it should be, which something, again, another terminology called descent. Perineal. Perineum is this part that you see in the skin, and descent is descent. Now, that needs a lot of attention. However, unfortunately, you developed something completely different, which caused the pain, acute pain you had last week. If we imagine the very last part of the anal canal that opens to the outside, it's an extremely important part and extremely complex. It is surrounded by 2 layers of muscles. One of them is what we call longitudinal muscles. It's like a tube that you do not control. And I draw them in different dimensions because normally they're about 2 millimeters in width or thickness. In you, it's about 5. It's really struggling. It's like you go to the gym and exercise your biceps, it gets bigger because they are struggling. They are trying to stop this bowel coming out for many years. And you have another layer of muscle that's literally composed of 3 tubes like that. These are the ones you control. And you hold tight to keep yourself dry and wait to go to the toilet. In your condition, because of what happened here, let's get another color. At the back, in the middle, you have a tear, and that tear is connected to a skin tag, and that is the sore. And what your muscles are trying to do is to rest this area, so if they are in constant spasm, they were lost weight. They are a lot better today because of the cream use. How do we treat that? Is to help the muscle relax by the cream you're using. So what we'll do, we'll wait until this heals completely. That will take another 7 weeks. And then we'll focus on this. Do not worry at all. There are so many ways to fix that together, right? The easiest surgical way is that we suspend everything up here. So what we do is to treat this from the inside without a cut, without an operation. Or we go through a training program. It's called biofeedback. It will be available here in a month or so.